following episode is brought to you by the American Urological Association. This special episode is all about the Society of Urological Robotic Surgeons meeting as part of Endourology Day at the 2025 annual meeting. Keep listening to hear about the agenda and the main clinical areas being highlighted from Dr. Michael Stifelman, President of the Society of Urological Robotic Surgeons.
Hi, my name is Jay Rahman, and I am Professor of Urology at Penn State Health and Chair of the AUA's Office of Education. It's my pleasure to host another episode in our educational podcast series, and this is one of the episodes that is focusing on some of our AUA 2025 meeting content. Specifically, we're going to be speaking about the Society of Urological Robotic Surgeons meeting, and we have pleasure of hosting Dr. Michael Stifelman. Dr. Stifelman is the president of SURS, or the Society of Urological Robotic Surgeons. He's the Northern Chair of Urology at Hackensack Meridian Health. He's also their founding chair and director of robotic surgery within that health system. He is internationally known as a minimally invasive robotic surgeon, as well as a reconstructive urologist, and has really done a phenomenal job building the Hackensack program into a premier force over the last 5 to 10 years. And it's really our pleasure to host him as the president of SURS to talk a little bit about SURS itself and the meeting and even more beyond that. So, Mike, again, I know you're busy. A big appreciation in taking some time to meet up and chat today.
Thank you so much for having me today, Jay, and really excited to be here and talk about everything robotics and talk a little bit about also everything SURS. So thank you.
No, absolutely. So maybe just for, our listeners, and it's always hard to know, we have a spectrum of listeners, those that are maybe thoroughly immersed in the robotics world and those that are frankly just towing their way in, maybe medical students, residents, maybe those that are practicing urologists, but don't know as much. Just tell us about SURS, if you don't mind, maybe a little bit of, when did SURS start? How does that sort of juxtapose with Endo Society and sort of elements like that?
Sure. So SURS is part of the Endourology Society. And it started literally 20 years ago with Raju Thomas was really the person that founded this sub-society under Endo. And the reason why we felt that it belonged under endourology, because historically endourology have been the innovators within our field. They are the ones that will bring the new technology first, evaluate it, and are constantly innovating. As far back as bringing ESWAL to ureteroscopy, to mini percs, to laparoscopic donor nephrectomies, to robotics, it's always been the endourologists who have been on that forefront, willing to take chances, willing to innovate, willing to evaluate new technology. So when robotics really became a huge part of what we do as urologists, it made a lot of sense to develop a sub-society under endourology, the umbrella, and that is SURS. And if you had to break it down to three things that we try to do within the Society of Urologic Robotic Surgery, it's about innovation, and it's about where can we use robotics to innovate. It's about education, giving residents, fellows, endourology fellows, transitioning attendings, people that have just come out of residency and starting to be an attending, and even older attendings wanting to get into robotics, a place to go and learn about that, as well as collaboration, bringing some of the greatest robotic surgeons in the world together to collaborate and to really push the field forward. And all of it is based on one thing, which is improving patient outcome. Always that is the first thing amongst what we do is, will this help patient outcome? And so that's where really SURS came from. That's some of the history behind it. It's some of the messaging that we're trying to get out there about innovation, collaboration, and education. And it's really why we decided it felt to be to create its home under the Endourology Society itself.
So, Mike, that's a great sort of historical perspective of SURS and the mission and the purpose. Maybe let's just talk a little bit of nuts and bolts. For the AUA 2025 meeting, first of all, when is it? When is this occurring?
Sure. You can't go if you don't know when it is, right? So it's going to be Monday, April 28th, and we have a slot for 4.5 hours from 1 p.m. to 5:30. So if you had a late night on Sunday, no problem. There's plenty of time to catch up. It's going to be from 1 to 5:30, and it's usually a standing room only sort of conference. We get a lot of folks come into this session, and it's because we really focus on some of the innovations that are coming out, new technology, new procedures, and sort of new ideas, and a lot of collaboration. So again, mark your calendars. April 28th, Monday. It's going to be from 1 to 5:30.
That's great. And can you give us a little bit of a sense? Are there certain areas within the agenda this year? Do you have, let's just say somebody's listening to this and they're really interested in the content. Do you have any of the specifics on what's getting covered? Is it didactics? Is it some panel discussions? Is it some video breakdown? All of the above, some of the above?
Yeah.
Talk about some of the details of the meeting.
Great question. So we really wanted it to be very interactive, number one, and I'll talk to you about how we're going to do that. We wanted it to be covering, where the puck is going in urology, and we wanted to focus on things that we don't always focus on. I don't know if I can look at another Retsia sparing prostate surgery. It's great, and we were going to see some of that, but that's not the focus. So a couple of highlights. Number one, we're going to spend a fair amount of time talking about artificial intelligence. Andrew Ng, who is the father of this, is going to give a presentation on how we're going to be using AI specifically in the operating room, where we're going to be segmenting out surgeries, putting what's called objective performance indicators on those different segments to help us understand not only how we can teach better, but how we can operate better and how we can improve outcomes for our patients. So that's going to be a nice early session along with simulation in robotics. And again, I think that's important because as we move forward in our field, we're going to be leveraging and embracing both artificial intelligence to help us understand what we're doing in the operating room, both good and bad, and embracing simulation to help us teach us how to do things better and be more prepared in the operating room. So I think those are two key take-home messages that we're going to be focused in on. We're going to spend a fair amount of time talking about robotic urinary tract reconstruction and robotic cystectomy and urinary diversion. These are two areas that in the past have always been at the end of the agenda. We're going to move them up to the beginning of the agenda. And I think that's important because these are the two highest growing areas in robotics. And we're going to teach these sessions in a combination of ways. First of all, there are going to be some really amazing world-renowned speakers who are presenting their data and their videos and some of their concepts. And then at the end of each of these presentations, we're going to have an opportunity to actually present 4 or 5 cases. And then we're going to put those to the audience to talk about the idiosyncrasies of each of these cases and how they would approach them with the knowledge that they've learned from today. And there's going to be a lot of back and forth with that. So it's going to be a combination of, new technologies, new techniques, and videos. But at the end, we're going to sort of bring it all together by presenting different cases where maybe one technique would be a better approach versus the other technique, and start to personalize the way we approach our patients, not just in which platform we use, what procedure we use, what technique we use, but also, understanding the limitations of each. And then another part of the program, I know it's a lot to pack in here, and we're going to do it. We're going to talk about renal transplantation. This is an area that is growing, and it's one of those things we need to get on the bus, and we should be owning this as urologists. So we have some great speakers. We're going to be talking about not just donor renal transplantation, but recipient transplantation with robotics. And then finally, we will have, toward the end of our session, a little talk about prostate and some of the new things coming out in prostate surgery, such as transvesical single port prostatectomy, extraperitoneal prostatectomy, and Retsia sparing. So not the classic transperitoneal, approach that we all have learned, but looking at other techniques and other approaches to take care of prostate cancer. So a lot to unpack there, but it's going to be a great agenda. We've got some amazing speakers, international speakers from around the world joining us and collaborating with us to put on this.
Yeah, it's really, really outstanding agenda. Obviously, congrats to you and the program and the planning committee. I certainly know that when we look at a lot of our feedback just for sort of the general AUA meeting, I think two of the areas that are clearly everyone is looking at is AI and simulation. That's true. Obviously, we're talking about this as it applies to robotics, but I think AI is obviously increasingly pervasive everywhere, and then the concept of simulation is one where I think it's increasingly becoming the way that we need to think about teaching and honing skills. So I think it's absolutely super that this has been included. What if
I'm going to jump on there for a second, because if you think about that, right, Jay, you mentioned two things, right? AI and simulation. And if you think about it, robotics leads the way in both of those, right? Mm-hmm. So robotic surgery, and there's a couple of companies out there that have done this. Theator has done this. Intuitive Surgical has done this. But we are now at a point in time that we've never been at in the history of surgery. And that is that we can, using artificial intelligence, segment out surgeries to specific parts, different segments. Never before were we able to go and look at a video and using AI segment it out into specific parts. Mm-hmm. Then think about that. Now we can start comparing the way Jay does his seminal vesicle dissection to the way I do it, the way someone else. So the access to that, mm-hmm. the availability of that, the ease of that to share that is never been done before. And then think about what we're doing now with the Da Vinci 5, where we're able to pull in all of these objective performance indicators. How much energy I use, what was my pressure, what was my Newton force, what was the time, what was the, my hand movements, what was my angle movements, all of that's being laid on top. So never have we been able to quantify what we are doing during surgery. And now we can. And I think this is, to me, as a surgeon, one of the most exciting times I've seen, since the introduction of robotics, this ability to quantify what we're doing to surgery so we can start comparing things to each other, and with the hope and the goal of making all of us better and understanding there's a lot of noise out there, right? If you think about prostate surgery, should I put a clip on the pedicle or should I cut it, sharply? Should I use heat or should I use cold saline? And there's all this noise about, what does this actually mean? But now we're going to be able to really understand it at a much deeper level and quantify it much more accurately. And you can't measure something if you can't determine an outcome if you can't measure it. Mm-hmm. Finally measure what we're doing in surgery. So I am really excited about how robotics is really leading the way in this. And the same thing is true with simulation, right? You look at Dr. John Joseph's labs, you look at Dr. Ghazi, you look at the folks at Lazarus, all these different companies. A lot of those companies, not all of them, but a lot of the energy is putting toward robotics and how we can create models mm-hmm. to train surgeons. Now they're using it for HOLAP, they're using it for prostheses. There's many different areas within urology that we're starting to use simulation, but this is an area that I think around robotics at the forefront. And so we're going to be sharing a lot of that with the audience.
That's great. What if, obviously the AUA is a very busy meeting and there's a lot of competing content. And we're doing, I think, a better and better job at being able to capture a lot of this digitally and allowing people to access it. But let's just say, folks are really interested in what we talked about, but they can't make it to the SIRS meeting. Can you talk a little bit about what are other ways to sort of engage with SIRS outside of maybe the annual meeting itself, other meetings, other venues? Talk a little bit about that.
Yeah, that's a great question, and the idea behind SIRS is it is a society and an organization that really focuses on those things of innovation, education, collaboration. So right now, another easy thing to do is we have another society meeting coming up in September out in Arizona. World Congress of Endourology and Technology is going to be in Arizona this year in September. Dates are out already, and SIRS is going to be a big part of that. We're going to be part of the plenary session. We're going to have another full day session all about robotics. We're going to be combining with focal therapy and talking about how focal therapy and robotics are intersecting to help treat these localized cancers like prostate and kidney. And there's a great opportunity there. In addition, we are opening up for endourology fellows, specifically ones that are doing robotics, like a single port masterclass for them that we're going to bring them through an entire year to train them on single port, a new technology. We are creating a website where we have all of our videos that have been presented at the World Congress are now going to be available to those in the society. And they're going to be really, and we're working on it. It's getting better and better with each iteration, but it's going to be very easy to search for it. So you can go to our site and start to look, if you're a member, and look for specific videos. I want to see, prostatectomy with a BMI of 31, and a median lobe, and I want to see how they did the bladder neck reconstruction. There could be that sort of granularity that we can get you to that. We're adding another video site within our society that has full surgeries, live surgeries from beginning to end. So it's not just these snippets of 7 minutes, this is what it looks like best, but the whole thing. So again, if you're a resident, you're a young attending, you want to sort of visualize the whole thing, you can do that. And we're creating other classes throughout and webinars and podcasts and working with research. And there's a lot one can gain from joining the Society of Urologic Robotic Surgery. And not just the 2 or 3 meetings that we put on every year, but really educational opportunities, collaborative opportunities, and research opportunities.
That's great. Any final messages you'd like to leave with our listeners? I mean, we've covered a lot of ground here, both about the society, obviously the meeting at the AUA. You talked obviously very nicely about the opportunity in September, juxtaposed with the World Congress of Endourology. Any other final messages for our listeners?
I think if you are interested in robotics at all, right, and that means if you're like, just dipping your toe in the water and seeing if this is something for you. If you're a medical student, you're a resident, you're a fellow, you're an attending that does 500 robotic surgeries a year, you should really seriously consider joining the Society of Urologic Robotic Surgery, because there's an opportunity for everybody to be involved and to collaborate and teach. And I think it's an incredible opportunity for us to bring in more members. And I think we're just sort of at the tip of the iceberg, and I think each year we are finding ways to improve the content that we can serve our members. We are constantly improving how we can deliver better videos and better teaching opportunities. And we're really sort of moving and focusing, doubling down on how we can all work together and collaborate for research as well. And so I think there's some great opportunities out there. It's really easy to join. Society of Urologic Robotic Surgery. We live under the Endourology Society. There's a lot of benefits that come out of joining that society and endourology, and I encourage you to do it. And if you just want to test it out and see what it's all about, show up. April 28th, Monday, 1 o'clock. It's going to be a great 4.5-hour session. You'll get a little feel of what we're all about, the energy that comes with it, and I hope to see you there.
Well, super. That was really very well said, Mike. And a big thanks to you for taking some time to chat. Big thanks to our listeners for taking a little bit of time out of your day to catch up with us on this podcast. For more information, visit us at auanet.org/university. Obviously, for those attending the AUA 2025 meeting, we hope to see you at the SIRS meeting. Mike, I look forward to seeing you in a few weeks in Las Vegas. Again, big thanks for taking some time today.
Jay, thank you so much. A real honor to be able to have an opportunity to speak to the AUA and to all your listeners. And Jay, you've done an amazing job, and I really appreciate all the work and effort you've put in to helping us as urologists really move the field forward and take better care of our patients every day.
Thank you very much. Very kind.
Thank you.